Hello, this is Dan Belanger of the New York State Department of Health AIDS Institute, and I'm honored to be here with you to share some of the strategies developed in New York State to improve care and outcomes for people aging with HIV. Many of these were developed with consumers, HIV care providers, and academia working in collaboration together. So this is important because 1% of all people in New York State are over the age of 55 are HIV positive, while 56.6% of all people with HIV in New York State are over the age of 50, and 26.7% are over the age of 60. And this data is as of 2019. So some of the things that New York State has done so far to improve care and outcomes for people aging with HIV, the New York State and in the epidemic blueprint has focused on disparities in outcomes for many subgroups of patients, including people aging with HIV. And many programs and activities have been developed because of the blueprint to improve care and outcomes for people aging with HIV. Also, the AIDS Institute has a quality advisory committee and a consumer advisory committee that have formed a subcommittee to focus on improving care and outcomes for people aging with HIV, as well as long-term survivors of HIV. And just say here that people aging with HIV for the subcommittee are defined as people 50 and older with HIV, and long-term survivors are defined as people who have been HIV positive for 15 years or more. So the New York State HIV Guidelines Committee, working with Johns Hopkins University, have developed guidelines for the care of people aging with HIV. So I want to tell you about a couple of funding opportunities for providers in New York State. The first is a SPNS, or Special Project of National Significance program, and it funds 10 providers across the United States to identify, implement, and evaluate activities to improve the care and outcomes of people aging with HIV. This is a 3-year opportunity that started in August, and it will continue, and it is led by Clement Steinbach. So this project, also the SPNS project, is funded by HRSA. So we have a New York State project that's funded by the AIDS Institute and HRI. And this also funds 10 programs to implement strategies to improve care and outcomes for people aging with HIV in New York State. And it's led by John Hartigan. It's a 5-year program. And both of these programs will focus on, gathering information about the uptake the providers have for the particular funding opportunity, as well as the tools and strategies that each of the providers have for improving care and outcomes for people aging with HIV. And this will be shared widely amongst providers across the state and the country. So these two programs will work very, very closely together. The SPNS program will provide the capacity building, especially around quality improvement and quality management, for both the national and the New York State program. A staff will be shared between the two programs to make sure that all of the opportunities are aligned. All of the strategies and tools will be shared between these two programs as well. The New York State program will also have a learning collaborative that they facilitate for the providers to do peer learning about what's working and where there are challenges that might come up. And so I want to now tell you a little bit about a program that was developed by the Quality Advisory Committee and Consumer Advisory Committee subcommittees to help improve care and outcome for people aging with HIV, as well as for long-term survivors of HIV. So this started in 2019 with a survey that was developed by Dr. Brown of Syracuse University that surveyed people aging with HIV as well as providers to understand where the gaps were in care. So next, various quality improvement tools like the driver diagram shown here were used to help providers, consumers, and public health staff to identify strategies to improve care and outcomes for people aging with HIV as well as long-term survivors. And then a ICOPE screening tool was modified to meet the needs of people aging with HIV and long-term survivors of HIV. So next, we put together a screening pilot. It's led by Dr. Siegler and John Wiccaria. And this is a pilot that began on August 1st and will go to November 15th. So we're asking providers to choose any 8 weeks during that time frame to test out the screening tool that was developed to screen patients. Case managers or peers or nursing staff can use the screening tool prior to the patient going to see the medical provider, so that when the patient sees the provider, the provider will have the screening tool completed to understand what areas the patient may need to have further care and support. And so after the first 4 weeks of the 8-week period, we're asking providers to analyze their data to see if there are trends and outcomes in the screenings that might suggest that they need to make some clinic process changes to better support their patients. And then we ask them to submit to the AIDS Institute. Then after the 8-week period, we will be asking them to submit also their data and outcomes. And we'll be having a peer learning collaborative on a monthly basis so the providers can share what's working and what challenges they may be facing. So next steps for the SPINS project, they will continue this for the next 3 years, starting August 1st, and gathering information and developing best practices for what works best. The New York State program starts in December and will go for 5 years, and we'll also be working very closely with the SPINS program and developing an understanding of what's working best for wide dissemination. The screening pilot will be completed in November, and then we will share the results of the screening pilot with the Quality Advisory Committee and the Consumer Advisory Committee, who will then discuss the feasibility of implementing this statewide. And so thank you very much, and I look forward to any questions you may have.